Is applying heat good for spinal stenosis? Spinal stenosis is a spinal condition that causes narrowing of the space within the spinal canal or the nerves that exit the spine. The spinal canal contains the spinal cord, which is a bundle of nerves that branches out through every bones of the vertebra that extend out into the body. And these spinal nerves control all the functions of your body, including movement, functions of your organs and tissues, and also sensations. Spinal stenosis can cause compression and irritation and impingement to these nerves as a result of this compression to these nerve tissues. Heat therapy can help relieve symptoms associated with spinal stenosis, but unfortunately, heat therapy normally can't treat the condition itself. And because heat therapy can help relieve tight muscles, help improve sometimes blood flow, it can help the area feel better, meaning by providing pain relief. But to truly treat spinal stenosis, that treatment must address the underlying cause. And this is really the best way to deal with spinal stenosis. When we look at spinal stenosis, I like to break down the causes into two main kinds. One that we call degenerative findings and one that we call alignment findings. Now, degenerative findings typically involve the discs or the bones of the spine. And these discs, unfortunately, can bulge or herniate, and they put pressure into the spinal canal and into the nerves by decreasing the space. This disc herniation or bulging, as it irritates the nerves, can lead to something called spinal stenosis. Arthritis of the spine or degeneration of the spine, because the spine's out of alignment for a period of time, can also cause bone spurs. And these bone spurs or degenerative findings to the bones can also decrease the space in the spinal canal and the nerves that exit, which can also lead to spinal stenosis. Other spinal conditions like misalignments to the spine can also lead to things like spinal stenosis, because when you change the alignment between two vertebrae, you decrease the relative space from one bone to the other. And that can also lead to a alignment version of spinal stenosis. And these are things like scoliosis, subluxations, misalignments, kyphosis, loss of lordosis. So either degenerative findings or alignment findings. Now, most patients will have a combination of both things. They'll have both things that they'll have to deal with, because alignment issues typically lead to degenerative findings. Now, when we look at one major alignment problem, this would be something like scoliosis. And how can scoliosis lead to stenosis? Well, like I mentioned, the scoliosis causes the spine to bend and twist. And this unnatural bending and twisting within the spine can be compressive to the nerves and tissues that exit throughout the spine because of the uneven pressure and alignment that exists between these bones, meaning that there's a loss of space. And as the space decreases, the scoliosis can also increase wear and tear to the spine, leading to degenerative findings within the spine. And so therefore, the best way to minimize symptoms of spinal stenosis is to treat the actual condition, what's actually causing it. Not only is it limited to scoliosis, but it could be other things like I mentioned, hyperkyphosis, loss of lordosis. Any alignment issue can affect the spacing, which can lead to degeneration. Now, some symptoms associated with spinal stenosis, it's typically going to be associated with where the stenosis is. So if it's more in the lower back, you may have more low back pain. You may have burning down into the legs and into the feet. You may have some lower body weakness. You may have sensation of numbness or tingling into the legs. And in severe issues, it could cause bowel or sexual malfunctions within organs and tissues. In the upper body, it's going to be affecting the upper part of the body. So you have stenosis into the neck or upper back. It could affect your pain in the neck or upper back. It can cause problems to the shoulders, arms, forearms, and fingers. You may have numbness and weakness into those areas. So therefore, it's normally where the stenosis is located and what nerves that are being affected. Now, spinal stenosis can be addressed through many different means, meaning the symptoms. A lot of times you can have pain medications, you can get injections, but normally you want to address what's causing the stenosis, and that normally has to do with degeneration and alignment. Alignment's typically best affected with some type of therapy, chiropractic care, physical therapy, exercise therapy, some type of rehabilitation that's going to be looking at the alignment and the degeneration and trying to improve that. And in very severe cases, surgery can be considered. While heat therapy may improve pain, it's not really addressing the underlying cause, and the way to get substantial or sustainable pain relief with stenosis is really addressing the underlying cause. Thanks for watching. I hope you found this information helpful. If you have any questions about this topic or other scoliosis questions, type in the comments below and let us know. And finally, subscribe and hit the bell icon to be notified of when we publish new videos just like this.